Medicare Part D Explained. If you are researching Medicare and you want to know more about Medicare Part D prescription drug plans, this is the video that you need to see. Medicare Part D Explained. So stay tuned. Hi, I'm Matthew Clausen with Medigapseminars.org. We are an independent insurance broker helping people with their Medicare and retirement needs in 49 states, from Hawaii to Virginia and Alaska down to the Florida Keys. We're a true independent insurance broker. That means that we work with all the major insurance companies and offer all Medicare supplement plans. Most of all, we represent your best interest, not that of any insurance company. And our services are free to you, the consumer. Check out our 5-star ratings, then contact us. You'll be glad you did. I understand how confusing Medicare can be. I help people with their Medicare decisions every day. My mission is to help you make an informed decision about your Medicare choices. That is why in this video, I'm going to go over the Medicare Part D prescription drug program. This is the prescription drug portion of my Medicare Explained video series, which includes my videos titled Medicare Explained, Medicare Supplement Plans Explained, Medicare Advantage Plans Explained, and How to Sign Up for Medicare. You'll find these free educational videos plus dozens more when you subscribe to my YouTube channel. You can also visit my website, Medigapseminars.org, or you can just type in the hashtag Medigapseminars in the YouTube or Google search bar. Understanding the Medicare Part D prescription drug plan is important because it's one of the areas of Medicare where you, the consumer, can make some of the most expensive mistakes in Medicare. I'm going to help you avoid those mistakes in this video. I've structured the Medicare Part D Explained portion of this series into 2 videos. This video, the first one, is for everybody on Medicare. It's what you need to know about the Medicare Part D plan, whether you're currently on no prescriptions or are already spending thousands of dollars on your prescriptions. The second part will be mostly for people who have either a very expensive prescription or simply spend a lot of money on their prescription drugs. The second section will cover concepts like the coverage gap, which used to be called the donut hole, and catastrophic coverage and low-income subsidy, as well as list out ways and resources that you can use to lower your prescription drug costs. All of that is important to understand if you're spending hundreds or thousands of dollars a year on medications. If this is your first time through this video, you might want to get a pencil and paper handy because we're going to cover a lot of information. It's important because, as I mentioned earlier, mistakes can be costly. So let's get started with the basics. There are 4 different ways that you can be prescribed a medication. How your medication is prescribed and administered will determine which part of Medicare is responsible for your payment. First, you can be prescribed a medication when you're an inpatient in a hospital. This is medication you can only take while you're an inpatient and you cannot take it home with you. This may include daily medications that you're currently taking at home and will need to continue during your hospital stay. Medication provided to you while you're an inpatient in a hospital is covered under Medicare Part A inpatient services. In case you didn't know it, when you are an inpatient in a hospital, you can't bring your own prescriptions from home. They're prescribed, the same medications are prescribed and taken while you are an inpatient. Next, you can be prescribed medication that's administered by a medical professional at a medical facility. Now, this could be anti-inflammatory infusions, some chemotherapies, shots, etc. Prescribed medication administered by a medical professional at a medical facility is typically covered under Medicare Part B outpatient services. Third is a concept called brown bagging and white bagging prescriptions. This is important and it's become more common in recent years. Brown bagging is when a pharmacy delivers a prescription to you, the consumer, who then brings that prescription to the doctor's office for it to be administered by a professional. White bagging is when the pharmacy delivers the patient's prescriptions directly to the doctor's office, where a medical professional will then administer the prescription. So brown bagging and white bagging are growing trends in medical care because they take the prescriptions that would normally be covered under your Medicare Part B outpatient services and transfers the cost-sharing burden to your Medicare Part D prescription drug plan. In doing so, it relieves the financial pressure placed on the doctor's office to purchase and store these medications, which can cost thousands of dollars. So although it's a growing trend, it is still reserved for very expensive specialty drugs like some chemotherapies. So again, brown bagging and white bagging prescriptions are covered under Medicare Part D prescription drug plan. The fourth way to be prescribed a medication is when your doctor writes a script and you pick it up from a pharmacy or via mail order and then self-administer it. This could be a pill, a self-injectable pen, an ointment, an inhaler, and so on. You pick up the prescription and administer it to yourself. Prescriptions of this nature are covered under your Medicare Part D prescription drug program. So the simple rule of thumb is that if you're picking up a prescription from a pharmacy or via mail order and you're self-administering that prescription, it will be covered under your Medicare Part D prescription drug program. Otherwise, it's typically covered by a different part of your Medicare. The one exception is the brown bagging and white bagging concepts that pertain to some very high-cost specialty prescriptions. The next thing you need to know about Medicare Part D prescription drug plan is that all of the Medicare Part D plans end on December 31st of each year. These are one-year, calendar year plans. Whenever you get a plan, your commitment to the insurance company and the benefits that they promised you in the policy are only until December 31st. What's also important to understand about Medicare Part D is that every plan is different. They're the exact opposite of a Medicare supplement plan. As you may know already, depending on where you are in your research, the benefits of a Medicare supplement plan are standardized to be identical from one insurance company to another and can never change. It's not that way with Part D prescription drug plans. Each Part D plan is different. Some insurance companies have multiple plans, each different from the other. Medicare Part D plans are regulated to meet certain minimum requirements. So, for example, they must cover a minimum of 2 drugs from every category, and that means at least 2 high blood pressure medications, at least 2 statins for cholesterol, etc. In addition, they must cover all or substantially all of the available prescriptions from 6 protected classes. These protected classes are immunosuppressants, antidepressants, antipsychotics, anticonvulsants, antiretrovirals, and antineoplastics, which are medications used to treat cancer, more commonly referred to now as anti-cancer medication. Every Part D plan must cover substantially all of the prescriptions available in those 6 categories. To recap, Medicare Part D plans are regulated to meet certain minimum requirements and must cover prescriptions from every category or condition, but each plan is different. Each covers different prescriptions and can charge different prices for the same prescriptions. Next, there are 2 terms that you're going to need to know regarding Medicare Part D prescription drug plans, and you might want to write this down. The first is formulary, the second is tier. A formulary is the list of prescriptions covered by a specific Part D plan. Within the formulary, the drugs are categorized by tier. So the formulary is the list of drugs covered by the specific Part D plan. The tier is the price level or cost sharing in which the prescriptions are categorized. There are typically 5 tiers, although I have seen 6 tiers in at least one plan. So Tier 1 typically consists of your most common generic prescriptions. These are your lowest cost prescription drugs. Tier 2 may include some generic prescriptions and some preferred brand name drugs from manufacturers contracted with your Part D insurance company. Now, Tier 3 may have some generic drugs, but it mostly consists of brand name drugs. And Tier 4 and 5 are your expensive specialty prescriptions. Keep in mind, because each plan can choose which manufacturers with which to contract, a Tier 3 drug with one plan may be a Tier 2 drug with another. It's the individual Part D drug plan that categorizes your prescriptions into a tier based on their relationship with the manufacturer of the drug. Each Part D plan must also have a process for you where if you are prescribed a drug that's not covered by your plan, not on the formulary, the Part D plan must allow you and your doctor a simple and fair appeals process to have the drug covered just for you. But beyond the regulated characteristics, each plan is different. They have different premiums. They charge different prices for the same prescription. And also each Part D plan may utilize a different group or different network of pharmacies. That means some Part D plans may have their best prices through CVS, maybe some through Walmart, some through Costco or Walgreens or your grocery store, etc. That brings up another very common mistake. Don't assume that the pharmacy with the lowest prices using your current insurance will also have the lowest prices with your new Part D plan. It doesn't work that way. Before I get into some common misperceptions and costly mistakes, I'd like to ask a favor of you. First, if you like this video and you find the information that I share helpful, please press the like button down below and leave a brief comment. Doing so helps this video show up in search results so that others who are searching for a Part D video will find this video just as you did. And second, when you're ready to shop for a Part D plan, please go to my website, medigapseminars.org, or a new site that I'm setting up called partdshopper.com that's going to be launched as of October 15th, 2020. Either way, you are going to see which Medicare prescription drug programs that I recommend. You're going to have the same data, the same shopping ability as you do on the Medicare website itself, but we also show more information and have it presented in a more consumer-friendly format for you. So that's partdshopper.com. Thank you. So let's get back to Part D. Now, there's a very common misperception that I hope to help you avoid. A common mistake that people make is to assume that a higher premium Part D plan offers more benefits or more coverage than a lower premium plan. That's not true. The pricing of Part D premiums is not like buying clothes or a car where the higher you pay, the more quality you're going to expect. The average premium for Part D plans is approximately $35 a month. Lower premium plans are designed for people with a few or just generic prescriptions. Higher premium plans are designed for people with expensive prescriptions. And I get into why in my second video on the Part D plans. Just keep in mind that a higher premium does not mean better or more comprehensive coverage. I've seen too often where people with a modest level of generic prescriptions purchase a high premium Part D plan thinking it offers more coverage just in case they get seriously ill. Then they end up paying a high price for their generic prescriptions and hundreds of dollars more than they should in premiums. So more on that in the details in the Part 2 video. Considering all of the above, this means that we can't determine the right plan for you without taking into consideration your specific prescriptions and the pharmacy that you wish to use and how much the Part D insurance company will charge you for the prescriptions that you know you'll be taking in the year ahead. When you shop a Part D plan, find a well-rated company that offers you a low price for your prescriptions where you can use the pharmacy of your choice or mail order if you prefer. Don't create hypothetical situations. That's a never-ending loop. Just remember, you can change your Part D plan every year during the annual enrollment, so it's a short-term decision. The third characteristic to understand about Medicare Part D plans is that any feature of a Medicare Part D plan can change from one calendar year to another. It's a moving target. The price can change, the benefits can change, the prescriptions covered can change, and so on. In fact, in each of the last few years, I've watched as insurance companies have outright canceled one plan and introduced a new plan. Because the benefits change each calendar year, you have the right to shop for a new Part D plan every year. You'll use the annual election period from October 15th through December 7th of each year to review next year's plans and decide if you want to stay with the plan you have or change to a new plan. If you want to stay with the plan you have, do nothing. It'll roll over automatically. If you wish to make a change, simply apply for the new plan. Medicare will cancel the old plan and transition you to the new plan as of January 1. Your new Part D prescription drug plan will then start on January 1. This brings us to enrollment periods. But before we can go through when you can purchase a Part D prescription drug plan, we're going to first have to cover an important point about how you can get a Medicare Part D plan. Now, this point is critical because I've seen people accidentally cancel their Medicare coverage and not know it with this one mistake. You can get a Medicare Part D prescription drug plan in one of two ways. The most common way that people get a Part D prescription drug plan is via a standalone Part D plan. We also refer to this as a PDP plan. A standalone plan is just that. It's a separate plan not linked to any other part of your Medicare. This is typically for people who want to keep your original Medicare, your Part A and your Part B, and you can also have a Medicare supplement plan to limit your financial risk, and use the standalone Part D plan for your prescriptions. The great part about a standalone prescription drug plan is that each year you can use the annual election period to shop for and enroll in the best Part D plan for your situation without having to make changes to any other part of your Medicare. The second way you can get a Part D plan is to have one bundled with a Medicare Advantage plan. Most, not all Medicare Advantage plans come bundled with a Part D prescription drug plan. These are referred to as Medicare Advantage prescription drug plans, or MAPD for short. So as I detailed in my Medicare Advantage plans explained video, when you get a prescription drug plan bundled with your Medicare Advantage, HMO, or PPO, you must take the Part D plan offered. You may not shop for a better Part D plan. Because your health care, your Medicare Advantage plan is bundled with your Part D plan, you cannot change one without changing the other. When you get a Part D prescription drug plan bundled with your Medicare Advantage plan, the cost of prescriptions, the premium and the deductibles and so on are all calculated separately from your Medicare Advantage plan benefits. In fact, the maximum out-of-pocket on your Medicare Advantage plan does not include prescription drugs. That's an important concept to understand. With a Medicare Advantage plan, your maximum out-of-pocket costs do not include the costs involved with your bundled Part D prescription drug plan. The costs associated with your bundled Medicare Part D plan are in addition to the maximum out-of-pocket limits, your MOOP, set for your Medicare Advantage plan. So you can get a standalone Part D plan when you want to keep your original Medicare. You can shop that each year and it has no impact on your supplement or any other part of your Medicare. When you get a Medicare Advantage, HMO, or PPO, the Part D plan is bundled. You cannot change your Part D plan without changing your Medicare Advantage plan. Now this is critically important. This next feature is where you can accidentally lose your Medicare. You cannot have a standalone Part D prescription drug plan and a Medicare Advantage HMO or PPO at the same time. Medicare won't allow it. If you have a standalone Part D plan and you enroll in a Medicare Advantage HMO or PPO, Medicare will kick you out of your standalone prescription drug plan. It doesn't matter if your Medicare Advantage plan, HMO, or PPO included a Part D plan or not. You're not allowed to shop for your own separate standalone Part D plan when you have a Medicare Advantage HMO or PPO, period. Next, we're going to cover enrollment periods. Now, understanding the enrollment period is critically important because you can't just enroll in a Medicare Part D prescription drug plan whenever you want. Missing an enrollment period is one of the most common mistakes that I've seen people make with their Medicare prescription drug plan. Declaring the wrong enrollment period is also common. When you apply for a Medicare prescription drug program, on the application, it has to state what enrollment period you are using to apply for this plan. So this is because many people are focused on their Medicare supplement plan and they don't realize that the Medicare supplement plan and the Medicare Part D enrollment periods are completely different. So let's take a closer look and we'll hopefully make some sense out of these rules. So it's easiest to understand enrollment periods for Medicare Part D prescription drug plans when you categorize them. So first, there's an initial enrollment period. Now this is your first enrollment period when you're first eligible for Medicare. For most of us, that's the period when you're just turning 65. And it may also be when you're under 65 and you've been on supplemental income for 24 months due to disability. A second group of enrollment periods are annual enrollment periods. Now these happen every year, year in and year out, and they're based on a calendar year period. Last but not least are special enrollment periods. So a special enrollment period is triggered by an event. It can be an event you initiated or an event that was forced on you and is involuntary. That creates a special enrollment period. I'm going to review the most common enrollment periods. There are others not covered here. In addition, your state may have some extra ones of its own. So let's look at the details. Your first Medicare Part D enrollment period is your Medicare initial enrollment period. This is the 7-month period. It includes the month you turn 65, and then it's the 3 months before your birthday month, and of course your birthday month, and 3 months after your birthday month. This is your first opportunity to enroll in a Medicare Part A and Medicare Part B, and you use this period to enroll in a Medicare Part D prescription drug plan. Now, if you miss your initial enrollment period, you're going to have to wait for an annual enrollment period to get a Part D prescription drug plan, or the general enrollment period if you missed enrolling in Medicare entirely. If you decide to not start your Medicare entirely and you want to use employer coverage to put off enrolling in Medicare, so you have creditable employer group coverage, then you would create a special enrollment period when it's time to go off on your own and get your Medicare Part D prescription drug plan. You have one annual enrollment period that you need to be aware of. It's called the annual election period, also called AEP. The annual election period is the most important election period for Part D prescription drug plans next to your initial enrollment period. The annual election period is from October 15th through December 7th of each year. And you should mark these dates on your calendar, October 15th through December 7th, Pearl Harbor Day. This is a brief window of time when you get to see the benefits and the prices and what's changed for the next calendar year. Now, if you have no desire to switch to a new plan, then you don't need to do anything. You're just simply roll over into next year's version of the Medicare Part D plan you currently are enrolled in. If you do wish to make a change, then you simply apply for the Medicare Part D prescription drug plan that best fits your budget and your needs. Medicare will transition you to the new plan on January 1. Now this next concept is very important. A unique characteristic of the annual election period is that you can make as many changes as you wish during that period. You can select one Part D plan, then change your mind as much as you wish during this time period. Whatever Part D plan or Medicare Advantage plan was the last plan that you applied for during that period will be the one that you're committed to for the next calendar year. Now let's take a look at a special enrollment periods. As I indicated earlier, these are enrollment periods that are triggered by an event. The most commonly used is when your creditable coverage ends, your employer group coverage. If you decide to not enroll in Medicare as your primary insurance when you turn 65, and instead you utilize creditable employer group coverage, then your Medicare Part D prescription drug plan special enrollment period is the first 63 days after your creditable coverage ends. This is another period where mistakes are common. When a person decides to end their employer group coverage, they'll typically enroll in a Medicare Part B for the very first time. And then they'll learn that they have a 6-month window to enroll in a Medicare supplement plan and assume that same window applies for enrolling in their Medicare Part D prescription drug plan. It doesn't. You have only 63 days from the end of your creditable coverage to select and enroll in a Medicare Part D prescription drug plan. If you miss that period, then your next opportunity is going to be the annual election period. Another common mistake that happens during this enrollment period is selecting the wrong enrollment period on the application. When you apply for a Part D plan, you have to inform the insurance company which enrollment period you're using. When leaving employer coverage and you're over 65, don't select new to Medicare. That would be an initial enrollment period. Instead, select that you're losing employer or group coverage. In addition, once you enroll in a Part D prescription drug plan during this special enrollment period, your special enrollment period ends. In other words, you have one chance to enroll in a Part D plan during any special enrollment period. Once you submit your application, your special enrollment period comes to an end. So I want to repeat that. Under special enrollment periods, you have one chance to apply for and get a prescription drug plan. Once you've applied for a plan, your special enrollment period ends. You also have a special enrollment period when you move. Now, why would this be? Why can't you keep the same drug plan in Texas that you had in California? Well, it's because your Medicare Part D plan is local coverage. It's not national coverage like your original Medicare or your supplement. Now, you can still get prescriptions while you're out of town and traveling within the United States, of course. But if you move to a different county or a different state, you'll need to get a new Part D prescription drug plan based on your new zip code. It may be an identical plan, but its premium structure is based on your new address. When you move, you have 63 days from the date of move to get a new Medicare Part D plan. You can apply for a new plan before you move or up to 63 days after you move. Once you select and apply for a new prescription drug plan, your special enrollment period comes to an end. You get one choice during your special enrollment period. To recap, the enrollment periods that we just went through are not all the enrollment periods or special enrollment periods that may pertain to a Medicare Part D prescription drug plan. That list in its entirety it's much too comprehensive for this video. However, the ones I covered are the most common and by a wide margin, and also the most understood and the most error-prone. The most important concept that I can stress is that your Medicare Part D enrollment periods are not related to your Medicare supplement enrollment periods. Please don't confuse the two. Of course, if you do err and go without Part D coverage or a creditable alternative, there are financial penalties. I have a separate video specifically on that subject linked below. I'm not going to get into the details here on that, except to say that potentially the biggest penalty for not having a Part D plan isn't the financial penalty that's levied by Medicare. It's the fact that if you don't have a Medicare prescription drug plan when you're initially supposed to, you can only get that plan during an annual enrollment period or a special enrollment period. There are prescriptions for major illnesses that can bankrupt the average person if you don't have a prescription drug plan, and I've seen that more than once. The entire purpose of the insurance is to transfer the financial risk of an event onto that of an insurance company. That way we don't turn a health crisis into a financial crisis. Risking a financial crisis to save $20 or less a month on Part D premiums just isn't worth it. All right, 2 more points before we close out this section of the video. These next 2 points are very often misunderstood or misinterpreted, yet they're critical to understanding when you're shopping for a Medicare supplement plan. It's critical to understand. In other words, we've seen people make some expensive mistakes because they didn't understand what I'm about to share with you here. Most Medicare Part D prescription drug plans have a deductible. A deductible is the amount of money that you'll spend before you receive any benefit from a plan. The maximum deductible is set by Medicare each year. But what's not clearly communicated on the government website is that the most common drugs are typically exempt from a deductible. Now, every year, Medicare sets a maximum allowable deductible for Part D plans. For the year 2020, the maximum deductible was $435. For 2021, the same deductible is $445, an increase of $10. Most plans will exempt the lower tier prescriptions from the deductible. With many plans, Tier 1 and Tier 2 prescriptions are exempt. Now, please don't assume that all Part D deductibles pertain to all prescriptions. Our website on the PartDshopper.com actually does a good job of showing you which tiers are exempt, if any. So again, the site uses the same data vendor as Medicare. It's the same data, it's just displayed in a more user-friendly format for you, and details about the deductibles, the network pharmacies, and so on. So that's PartDshopper.com. So to be clear, some plans are going to have a deductible, some plans won't. Usually the higher priced plans for people with a lot of coverage may have less or no deductible. Then some plans are going to exempt some of the tiers, Tier 1 prescriptions, Tier 1 and 2 prescriptions, and so on. You really need to look at that detail when you're shopping for your prescription drugs. And don't assume that even your lowest cost drugs are going to be subject to a deductible. So Part D restrictions. To control costs, a Medicare Part D prescription drug plan can restrict or limit some of your prescriptions. Keep in mind, most prescriptions that are processed are limited only by your doctor's orders. However, an insurance company can set limits in some cases just to save money for some cases, and others like opioids, there's federal restrictions. So I'm going to go through each of the 3 different methods in a moment, but it's important to understand that these can change significantly from one insurance company to another. So don't assume the restrictions set by one company will be repeated by other companies. As you shop for a Part D plan, you want to review the restrictions and compare. And of the 3, of course, there's one restrictions that I recommend trying to avoid. So the first restriction is the least inconvenient is prior authorization. If there is a prior authorization limit on your prescription, it simply means that the doctor must check with the insurance company before writing the prescription. Now, this is usually done electronically, and it's often while you're still in the doctor's office. So it's an inconvenience, but no more. The second potential restriction are quantity limits. Now, this is where the insurance company will limit how much of a prescription that they will permit during a time period. Sometimes a prescription quantity limit is set so high that most people are never going to be limited by them. For example, it may say that you're limited to no more than 120 pills a month and your prescription's set at 90 pills per month. Now that limit's beyond the limit of your prescription. When you have two competing Part D drug plans with similar costs, though, you should review the Part D drug limits to help find the right plan. So the most inconvenient and possibly disruptive of the three ways that a Medicare prescription drug plan can limit your prescription is limited by step therapy. With step therapy, you have to try lower cost alternatives first, and only if those lower cost alternatives fail to resolve your condition can you then have a prescription for the prescription that your doctor originally wanted. So the bottom line is you have to try some lower cost drugs before you can get to the one that your doctor originally wanted you to have. So those are the three common restrictions: prior authorization, quantity limits, and step therapy. If you would like to know which Part D companies I like the best, you're going to find that on my website, and of course on the partdshopper.com. I only show the plans, the insurance companies that I recommend. And of course you're going to find this system to be much easier, and it's much more detailed information than what you're going to find or try to use on the Medicare website. Yes, I will be compensated as well. In fact, in part 2 of this video, I detail how and how much an insurance broker like us are compensated for Part D plans. So please check out the Part 2 version of my Medicare Part D Explained and learn about the donut hole catastrophic coverage and how to reduce your prescription costs if you're dealing with some very expensive prescriptions. So now it's your turn. I make these videos for you. YouTube ranks these videos based on the numbers of likes, the comments, the people who share, and people who subscribe. If you found this video helpful and you believe that others would too, please press the like button and hit the bell icon so you can be notified when I publish more videos. And then leave a comment, anything. Let me know how you feel about this video or if you have questions. Also, please share. But when you like, comment, or share this video, you help me and you help others who would benefit from watching this video as well. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.